Hey, welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and we are getting ready to start a really busy month in our office. October 16th is going to be our annual fall festival. It's going to be in our Peoria office, and we're really looking forward to the event. We've already had over 500 registrations, so we look to have a great time. Someone's going to be fortunate to win braces, and so that's really exciting for us. And what also is exciting is October is National Orthodontic Health Month, and because it's National Orthodontic Health Month, I've decided that what we're going to do is sort of do a break away from our normal format, and what I'm going to do is kind of just answer some frequently asked orthodontic questions. And so one of the things that comes apart is a lot of kids will ask, can I play sports with braces on? And I just wanted to let you know that there are custom fitted mouth guards that kids can wear when they have braces on so that they can continue participating in sports. Another question that we always get asked is, can we play musical instruments with braces on? And the answer is yes. So if you have a child who's involved in music, playing a musical instrument, just understand that there's an adjustment period, but typically braces won't interfere with them playing the musical instrument of their choice. One of the other questions that we're asked is, what are my options if I don't want to have metal braces showing? And so there's really two or three options that we offer. One of the options that we do offer is Invisalign. The other option is ceramic braces. And then also there's also what we call lingual braces, which are braces that we put behind the teeth. So those are three options if you don't want the traditional metal showing braces. And so typically, either if you're a teenager getting ready for high school or if you're an adult, one of those three options typically will work for you. Another question that's a little bit off the chart is, can you have a stud? You know, some people have tongue rings, and can you have a stud on your tongue while you have braces on? And it's definitely possible. There might be a couple little tricks, but I just wanted to let you know that is also possible. Those are questions that a lot of kids ask us. A lot of questions that maybe parents will ask us is, if my teeth have been crooked for years, why do I need orthodontic treatment now? And a lot of times it really depends on where you are in life. And so a lot of times you'll see progressive damage to teeth over time. And so really what we want to do is either halt that damage or slow it down. If you have gum disease, having your teeth put in the right place will actually allow you to clean them better. So there's multiple reasons on why to act now. And so those are just things those are questions that you would want to sort of address back and forth with us. Can I afford orthodontic treatment? I had that question today, and a lot of orthodontists, because it's just understand, us included, we offer in-office financing options, and I always equate it to sort of having a gym membership. You can come in, you can get started with low monthly payments, and on a monthly basis, just make continual payments until you're done with orthodontic treatment. Another question that might arise is, if you're pregnant and is it a good time? You should definitely consult with your doctor about that, because there's a lot of hormonal changes that occur. But we definitely have patients who are pregnant and who undergo orthodontic treatment. Do teeth with braces need special care? I think I've beat this topic to a dead horse, but we definitely have an armamentarium to keeping your teeth clean while you're in orthodontic treatment. So those are things that we can go over. Another question that's always asked is, I see ads for perfect teeth in only 1 or 2 visits to the dentist. Will that give me straight teeth? And typically what you see there is those solutions are people where we're actually putting veneers on your teeth, and veneers can be either prepped veneers or unprepped, and that just means one is cut and one's not. So there's different options. So when we talk about having straight teeth in 1 or 2 visits, what they're talking about is using porcelain veneers. And so those are questions that you're going to want to ask on whether that's the best solution for you. Those can be costly, And sometimes it can be actually in excess of what actually braces would cost. So if you have natural, healthy teeth, choosing to do veneers to get that instantaneous smile may or may not work for you. And the last question is, how do I distinguish an orthodontist from a general dentist? Typically an orthodontist who has 2 to 3 years of education beyond dental school, and that's sort of like us doing specialty training. It's sort of like equate it into the medical field. If you have a stomach problem, you're probably going to go to a GI doctor, and if it's specialized to your stomach, you may not stay with your internal medicine doctor or your family med doctor if you have a specific problem. So those are just common questions that that are asked to us on a daily basis. Since it's National Orthodontic Health Month, we're probably going to go through some of these questions and maybe answer more questions as we go along in the month. But if you have any questions specifically, come into the office, help us visit. Have a great week, have a great weekend, and next week we'll see you on the Friday Focus.